this is Dr. Sean McWilliams from Disc Centers of America in Alpharetta and the Atlanta Spinal Correction Center. And this week, what I'd like to do is I'd like to show you a pre and post MRI of one of our patients of their neck. Now, this wonderful lady who was in her 60s had no pain, which is very interesting, even though when I show you her MRI, had multiple disc herniations. However, she couldn't turn her head. So she was constantly having to almost move like this, which was horrible because it makes it really hard to drive your car or just do basic things in your life. So we took this young lady through computerized spinal decompression for approximately about 2 to 2.5 months. We used some other wonderful tools with her as well to improve her range of motion and some chiropractic care very conservatively. And so I'd like to show you the difference in her pre and post and then tell you about her success as well. So if you look right here, you'll see her pre-MRI. This is her chin. This is the back of her neck right here. This is the C2 disc, 3. We had major herniation here. It's a C4 disc, C5 and C6. Major degenerative changes in those discs as well. This is her post-MRI after about 2.5 months of care to 3 months of care in our office. And when you look, you can see a dramatic reduction in this disc right here. You can start to see improved spacing between her discs as well. And this lady had a dramatic improvement in the range of motion. A few times she had commented she's had the best 2 to 3 years that she's had in the last 2 to 3 decades of her life. And I love those stories. I love sharing those with people because that's what this is all about. It's about you getting your quality of life back. If most patients would have went to an orthopedic surgeon on that, they probably would have been considered a pre-surgical candidate or wanted to get epidural injections or steroid injections. And we really don't want to have to use those if we don't want to. We know from the Mayo Clinic, Johns Hopkins, Stanford University studies that computerized spinal decompression has an 88 to 91% success rate on average for people. Here in our office, we have a 90% success rate as well, which I'm very proud of. But I'm excited about it because it means that we can get changes like this for our patients and patients that are suffering needlessly, who don't want to have surgery and think that there's no other option. So if you have herniated discs, if you have bulging discs, if you have degenerative disc disease, if you have spinal stenosis, if you have radiation or radiculopathies or neuropathies happening, I want you to remain hopeful, because I want you to know that there's some other non-surgical options out there that might make a really big difference for you in your life. So if you have x-rays or an MRI or you're dealing with these symptoms and suffering needlessly, please call my office. I offer a complimentary consultation. If you have images, we'll put them up on the TV like this. I'll go over them with you and give you a second opinion on it. And if I honestly think I can help you, I'll tell you exactly what we need to do to get you well. And if for some reason, if I don't think I can help you, I'll be honest with you too, and I'll let you know that. So if you have any questions, call my office, set a consultation out. We'll spend 15 or 20 minutes together. We'll go over your images with you. And let me see if we can add some value and hope to your life and increase the quality of your life naturally without drugs and without surgery. So until next week's pre and post MRI, this is Dr. McWilliams saying, here's to your health and here's to you getting a better quality of life back that you deserve naturally.